Welcome everybody. I'm Dr. Athos Patsalides, and this is the first of a series of webinars that will discuss the a variety of medical issues, including venous stenosis, pulsatile tinnitus, IIH, and so forth. We're going to do this once a month. It's a new effort, and thank you for joining. The idea is to present experiences, medical knowledge, and help patients understand their disease more. Obviously, the IIH and the pulsatile tinnitus patients are often experts in their disease, much more so than than their physicians, and that's why it's been like such a rewarding endeavor for me dealing with patients that are educated about their disease and they seek answers. The focus today will be a patient story, Ms. Jenna Cabral, that is patiently awaiting for introduction. This will be the webinar where she'll discuss her symptoms, her story, the journey that she went through. And but before we do that, I also want to introduce, on my right side, Kelly Hansken is the nurse practitioner I've been working with for more than 10 years at this point. And I just want to put a face to the name.
Hi guys, I'm Kelly. I'm Dr. Patsalides' nurse practitioner. I've worked with him for many years, I think since about 2009, in all different capacities. I was a nurse in the procedure room where he does the venous stenting, also a nurse in the recovery room. And then I've been his nurse practitioner. I started about 2014. So you'll have a lot of interaction with me if you ever become our patient. I'm always available for questions or issues that come up. I follow up pretty frequently with the patients.
And I think at some point you're going to have your own webinar here to discuss more of these issues. So the person that we are discussing today, I don't know if you can close off your screen. I think I see a patient who's, yeah, Ms. Morrow, thanks.
Yeah.
If you can,
Jenny, you're under my name, so just take off your video. There we go.
Okay. So sorry for that. But the today's, and everybody please stay mute except Ms. Cabral. And the today's webinar is focused on a patient who I met 4 or 5 months ago. And she has a story that is very typical for many of the patients that we see. And she wanted to help other patients by sharing her story. This was her idea to share the story, and I think this is a perfect forum. And I'm happy to introduce Ms. Jenna Cabral and her husband, who really wanted to help other patients by sharing their story and experiences. And they're like, this first webinar is basically their webinar. So I'm going to stay silent, and I'll wait for you to start.
Yeah, hi guys. Yep, my name is Jenna Cabral. This is my husband, Cody. I first just want to say thank you to Dr. Patsalides and his team for allowing myself to tell my story. I think I'm not a public speaker, but I do think it is very important to tell your story and talk more about this issue of pulsatile tinnitus, because it does affect a lot of people and not a lot of people talk about it. So since I've been treated by Dr. P, I have made it a point to kind of tell my story to people and just get the word out there, even to my physicians that I have been in contact with since my procedure. So I'm going to go over my story, and then if you guys have questions, I believe that'll be open at the end for discussion. So my pulsatile tinnitus started in the summer of 2019, and at first I just noticed it intermittently. So I would notice it when I would turn my head side to side, when I would push my bottom jaw forward. If I were to bend down and stand up, I would notice this like really weird whooshing or pressure sensation in my left ear, and I'd never noticed it before, and it felt like it kind of came out of the blue. So I had already had an appointment with a neurologist that I was seeing for some other autoimmune issues. And I briefly mentioned it to her at the end of our exam, because again, I really didn't think anything of it. I thought maybe it was just an ear issue or an ear infection that I was going through. And she thought it was different. I had previous scans in the past, like MRIs and CTs for other things. And she had looked through those and been like, you know, your tests are fine. But I think you should see an ENT, an ear, nose, and throat specialist. So I was like, okay. So I followed up with an ENT. This was like the first specialist that I had seen for this issue, and it was not the last. It's the very beginning of my story, and I feel like I've seen 15 other specialists after this. But he had told me that he felt like everything with my ear was fine, that he didn't see any signs of infection, and it was just something that I just had to kind of learn to live with. He didn't have an explanation for it. So at that point, I let a couple months go by. I felt like the whooshing was staying the same, but I was starting to get other symptoms like headaches frequently, like pressure headaches. Medications really didn't help with those. I noticed like positional dizziness, like if I were to go from laying down, standing up, or moving my head very fast, I would get like this wave of vertigo. And I just knew I didn't feel right. I'd never felt this way in my life. And I just knew that something was wrong with me, despite being told at this point that everything was fine. So that's when I kind of started reaching out to other specialists. I had seen multiple neurologists. I had seen otolaryngologist, which is like a, correct me if I'm wrong, Dr. P, like an ear, nose, or I'm sorry, ear and brain surgeon. I think I'm right there. I had also seen psychologists. I'd seen so many specialists, and not only was I not really getting a diagnosis from any of them, but they didn't even know what I meant when I said that I felt this whooshing in my ear. They'd never heard of it, or they had just told me that it was something that I had to just learn to live with, but it didn't make sense to me because I had been normal for so long, and I knew this was something that was not normal. So I ended up seeing, I actually worked for an ophthalmologist at the time, and I had gone over the symptoms with him, and he said that we should do a dilated exam. And it was probably the best thing I'd done, because he kind of got the ball rolling on this diagnosis, which led me to Dr. P. So I had a dilated exam, and I showed that my optic nerves had some swelling. It wasn't super significant, but it wasn't completely normal. So this ophthalmologist had wanted me to get a spinal tap done, and
it was worse than the left eye, which you had tinnitus on.
Yep, it was. So it was my the pulsatile tinnitus was only on my left side, and so was the optic nerve swelling. It was in both eyes, but it was slightly worse on the left side.
Let me ask you a question, Jenna.
Yep.
Did you have any visual? What you may have said this already, but did you have visual symptoms? Was something wrong with your vision, as far as you could tell?
So I would notice positionally when I would, like I said, go from bending down and standing up, I would almost get like a tunnel vision for maybe 30 seconds, where I would lose some of that peripheral vision, and then it would slowly come back. Later down the line, I started noticing more issues in my vision in my left eye, but at this point, I'd only noticed like occasional vision issues.
Did you have blurry vision, double vision?
I never had double vision, and I didn't notice a ton of blurred vision. Everything seemed normal to me besides this like tunneling, which I had worked with patients who had intracranial hypertension. I had seen like some of the things that I was noticing myself, I had seen in patients before that we would see at the clinic. So I knew it wasn't normal, and I knew that it was possibly like a pressure issue. So I got my spinal tap done, and my pressures were slightly elevated, but again, kind of borderline. I believe if anyone watching has ever had a spinal tap, my numbers were like 28 degrees of mercury, I think it is, Dr. P.
It's actually centimeters of water.
Centimeters of water, okay. All right, thank you for correcting me. But it was right borderline of being just above not normal. So it kind of was like left in the standstill of, do I have intracranial hypertension? Do I have pressure issues? And what else could possibly be the cause of this pulsatile tinnitus? I still was not getting any answers. And actually after my spinal tap, that's when my whooshing became 24/7. And I don't know if you have an answer for that either, Dr. P, of why that's the case for me.
That's unusual, I have to say, because if anything,
Mhm.
most patients after a spinal tap, when the pressure is even borderline elevated, they often say that even for an hour or a day or 2 days, the symptoms improve. And that's because, during lumbar puncture, some of the fluid is removed to
Right.
self-testing and to, as a trial of like normalizing the pressure. So it's unusual. I don't have the perfect explanation. I think it has to do with the fluid pressure changes from the lumbar puncture, but that's unusual. If anything, it's the opposite of what most people experience.
Unusual is my middle name, I think at this point. So yeah, that's when it became a big issue for me. That's when this whooshing in my left ear became like debilitating. So I'd seen all these specialists. I hadn't gotten any answers. I got the craziest diagnosis from some specialists, and it was like, how many more specialists can I possibly see? And I felt like I was going in circles. So at this point, it was more or less, what can I do to keep myself from not being so depressed every day? What can I do to cope with life at this point? So I had learned coping mechanisms. I joined a support group, which I'm sure some of the people attending this webinar are either part of or heard of. The Whooshers Unite is the name. Cody's heard a lot about them. I joined them just to feel like somebody understood what I was going through. And in that, I learned some coping mechanisms. So I would wear a headband at night with Bluetooth just so I could sleep. And even then, my quality of sleep was still terrible. I would wear a headphone in my left ear all the time, 24/7. I had 2 of them actually, because I would rotate. When one would run out of battery, I would use the other one, and I would just play white noise all the time.
Did you ever figure out that by pressing on your neck, the sound would improve? Did you?
Yeah.
Something that you figure out on your own, or a physician told you, or like a whoosher,
One of my fellow whoosers.
Yeah.
I would notice when I would push my jaw forward, it would get intense. If I like pressed on the side of my neck, the noise would stop for a couple seconds. So I definitely knew, and I actually felt like I was becoming more educated than the physicians that I was seeing. I was like having to explain myself, explain this diagnosis. A lot of them had never heard anything about it. And then I would say those things like, I know it's something to do with blood flow, because if I push on the side of my neck, the noise goes away, or if I push my jaw forward. So yeah, that's a good point. I just learned to live with it. And then I found through the Facebook group page that Dr. P had treated and successfully treated a lot of patients that were on that page. So I was like, you know what, I've already seen so many specialists, what's one more? So I sent my scans and had my first initial virtual visit. And I think you knew within the first 2 minutes of our visit exactly what my diagnosis was.
And what scans did you send that you already had done?
I had done everything at the point, but the ones that Dr. P had wanted to see was an MRB and an MRA.
Correct. So these are the first important scans for the workup of pulsatile tinnitus. And like in general, like these are the scans that show us the arteries and the veins in the head. MRA is for the arteries, MRV is for the veins. These are like MRI scans essentially that are focused not so much on the fleshy part of the brain. Like this is like an MRI scan does that. The MRA is focused on the arteries. The MRV is focused on the veins, and that's that's essentially what is necessary in patients with pulsatile tinnitus.
Yep. So my diagnosis was left venous sinus stenosis with a poststenotic aneurysm. So I got that. Okay. He's like, good. Okay. Yes. So I don't know if I expected to get a diagnosis. I think I'd struggled for so long and seen so many specialists and didn't ever get a diagnosis that I was a little I was shocked after the first appointment. I had a really hard time coping with the diagnosis. It sounded so much, I mean, it sounded very scary
Well,
to me.
you heard the aneurysm word.
I heard the aneurysm and it did freak me out a little bit. And even though Dr. Patsalides was so confident in my diagnosis, he was so calm on the phone. It was a 20-minute conversation just about the diagnosis. And in my case, it wasn't life-threatening. So I knew those things. It just was a matter of coping with, do I live with this awful noise and this feeling and these symptoms that I have, which I could have done. And it only would have progressively gotten worse. So do I live with that? And I'm only 25, so I hopefully would have had a long life of dealing with that and being miserable, or do I take the step and get it treated?
Correct, and that's, I sorry to interrupt you now, but I think it's an important, aspect, emotional aspect I see in patients, because you go from the concern of, does anybody know what this is?
Mm-hmm.
So, this question is mostly answered. And then you're like worried about what do I do now, right?
Yep.
So, and do I really want to have a procedure? Is this going to work? Does he know what he's talking about? And I understand this. And this, because you shift now, the agony is from, oh, I'm not crazy. Somebody saw something on the films and knows what's going on, to, okay, but now I have to deal with that diagnosis. And Cody, you made a good comment. It's like the word aneurysm is a very stressful word for many people. And I tried to make it very clear that, there is the arterial aneurysm that people, have hemorrhage and can die from. And then there's the venous aneurysm that is a safe, benign problem. But of course, it causes, it's part of the Pulsatile Tinnitus approach. But when you hear that word, the heart rate goes up for sure. So I have to make sure that people understand. But what you describe, I think, is very common, that you go from the, nobody knows what's going on. Now somebody knows what's going on, and I have to deal with the next step.
Right. Yep. And it's kind of like you hear for so long that your scans are clear. At least in my case, I had sent my scans to so many different physicians from so many different healthcare systems, and to constantly hear that your scans are normal, I don't have an explanation for this, to actually hear a diagnosis, then you start to question you. But I just can't explain the
or real quick, even the other ophthalmologist that was taking a look at it, she reviewed the case after your diagnosis and still was like, what are you talking about? What is he talking about? She didn't see it, or this doctor didn't see it. So it's not that there's a lack of confidence at all in your diagnosis. There was no other answer at the time, and that's what was really confusing her.
Yeah, it was confusing, but it also, like, you just feel so comfortable. It's the first time that you're getting a healthcare physician tell you that you're not crazy. It's the first time that you're hearing, I understand what you're talking about, and I know that this is not normal and it's treatable. So it's like a wave of emotions. It's exactly what you explain it to be. But it does take time to come to a point where you feel like, all right, I'm ready to take, I'm so miserable in my life, and it's affecting every aspect of my life. It's affecting my work life, my home life, my life with my relationships and my family, that I'm going to take the next leap of faith and I'm going to get it treated. So it took me, I think, from our first initial virtual visit.
We'll back up and kind of tell him what he advised to do after that first initial visit.
Dr. P said, take your time. Nothing's immediate. You don't have to treat anything right now. You could live with it, but it probably will get worse, which it did in the short period. I think it was like 4 to 5 months. He said, talk to your significant other, talk to your families, see what you want to do, and then just let me know. So I did that. We got married last September. So I know knowing what I know now, I definitely could have gotten the procedure done prior to the wedding, but I didn't know. It was a lot of unknown. So
you went back and forth a lot too. You would wake up one day saying that you're going to get it done, and then the next day I can live with it. When it wasn't as bad, she'd have good days, and then she can live with it. And then bad days where I want to go right now. So it's that back and forth. But obviously, sister's never going to pressure you to do anything. You never pressured, but the confidence is always in the back of your head that I can get this taken care of when I want to.
Yeah. So I had waited months and months and months. And when you say my good days were even miserable. Like, my family can attest, some of my family is in this Zoom call, but my family can attest that, like, I just wasn't myself. I was absolutely miserable. I was very depressed. It's definitely not like me to, I mean, I'm a little bit of a hermit crab, but I was like a very big hermit crab. I didn't want to do anything. I wanted to stay on the couch all day. I didn't want to be active because any activity I did would just make this whooshing more intense. So it just was a matter of what's my quality of life. You know, I'm only 25. I want to have kids. And at this point, what is my quality of life going to be like for the rest of my life if I decide to live with this? So then we booked the surgery.
What medications did you take until that time? Like, you know, because you mentioned medications, but you never really specified this. Do you remember, like, at least one?
Yes, I actually have it written down, but I bypassed that. Yeah, I went on Diamox after my spinal tap, which is a diuretic. And I started at like 500 milligrams and then no change. I had, like, throughout this whole process, all these months, the whole process was about 2.5 years. I had many dilated exams, and I would up the Diamox and I would go down on the Diamox, and it didn't do anything for me. I know some people it does, but in my case, the Diamox didn't work at all, and it just made me feel uncomfortable.
And it made carbonated drinks taste bad.
And I love Diet Coke, so that was a problem. But yeah, it didn't work for me. Yeah, I was told to try weight loss, try diet changes, everything I felt like I tried. And I didn't have the motivation really to try anything because I was so miserable, but nothing worked. Nothing worked for me. So then we took the leap of faith and we booked our, the surgery date in New York. We are from Michigan. So I think we're pretty close compared to some of the people that travel from out of the country to see Dr. P. But we drove, this was in November. I'm about 4 months post-op now. So we drove, what,
9.5 hours.
9.5 hours, stayed in a local hotel around the area. And the day before my procedure, we came in for the pre-op appointment. I was very nervous, kind of felt like I was dreaming. I couldn't believe that 2.5 years had passed and here I am sitting in the office. I'm like, I really can't turn back now. I'm already here. It's a long drive home. So Kelly,
and I wouldn't have
yeah, he wouldn't have let me too. Yeah. Kelly made me feel very comfortable. Dr. P reassured me. And then the next day was my surgery date. So if you want to step in, Dr. P.
Yeah, I want to just say, I think it's important, you know, for many patients who go through this, you know, understand what you felt like. That, you know, I think you alluded to it, but I think it's important, you know, your thoughts like the day before. What are you worried about? Because I ask, you know, sometimes I see patients worried, and I ask them these questions, you know, what are you worried about today? You know, is it the day of the procedure, or, you know, tomorrow is the day before? And I always get more or less the same answer, but, you know.
Yeah, I think I mean, with any procedure, there's always risks. I've had a lot of weird things happen to me. I've had a long history of autoimmune issues. And so I've had a lot of procedures, but for some reason, this one was most nerve-wracking for me, even though I was the most comfortable with the medical team that I was under, because you're messing around with your brain. I mean, that's just it. I was really nervous that something could go wrong. I specifically remember asking you about like stroke, like what's my risks? You know, that something bad is going to happen to me. And that definitely was my anxiety playing a huge role, but it's a valid question for sure.
And you're in an uncomfortable environment, not being that the office and everything's very nice, but you're out of state. You you felt like you couldn't go back because you were there. So that just adds to the extra anxiety of it.
I mean, I would say that it's very stressful for a patient to come here, to go to any hospital for any procedure, and then if it involves the brain, it's even like more stressful. And if you're like 8 hours away from your home, or even from the other part of the country, it adds, because you're always more comfortable close to your family, close to your home, the people that the places you have to stay in a hotel for like 2-3 days, all those things. Absolutely, I mean, these are normal. I would feel the same, or like so and this is something many patients share and experience. And the other many patients tell me also, I'm not worried about the procedure, I'm worried about if it doesn't work. Like, I mean, I think that's what I hear a lot. Like, and I don't know if we discussed that, or if you experienced that, or if this is something that was, in your head or not. But that's something else that I hear many times from the patients.
Yeah, I think for me it was more of like, obviously, if we're doing all of this, the goal is to have the whooshing go away forever. I don't feel like that was my biggest concern, because I just felt so confident. I just felt like someone finally understood what I was going through. And I know that you wouldn't have had me come all the way to New York if you didn't feel confident in your skills to treat me. So it wasn't so much that. For me, it was, what is recovery going to look like? What are the unknowns there? Just messing with the brain, messing with the heart, the vital organs. That's pretty much what freaked me out. But as far as surgery day goes, I mean, I've told so many people about how amazing and how comfortable and calm I felt. I'm not a very calm person. I have super bad anxiety. I actually had a session with my therapist the night before in the hotel room. And she's like, what are we going to do, Jenna? Because I knew the angiogram was going to be a portion of the procedure that I was awake for. That was probably the scariest part for me. And she's like, what are you going to do to stay calm? I'm like, oh my God, I don't know. She's like, well, why don't you just pick a place in your mind where you feel the most comfortable and just think about that. And so I had a game plan for surgery day, and I didn't need it. I'll tell you what, the nurses in pre-op, again, made me feel so comfortable, made Cody feel so comfortable and confident. And then as I'm getting wheeled back, I'm like, oh my God, this is intense. This is like a whole OR filled with people. And I think I was awake for like 10 minutes or less. And I was talking to the anesthesiologist, and I just felt, I don't know if I've ever felt that calm in any medical situation ever. But I just know that it happened really fast, and I didn't feel
the angiogram.
I didn't feel any pain. I didn't even feel when, I think you inserted in like my groin first. You can kind
Correct.
of.
We went from the femoral, what's called the femoral vein.
Yep.
In the groin area. Correct.
Yep. I didn't feel any of that.
That was one of the most talked about uncomfortable parts of the procedure on the page, and you didn't experience that. It was very smooth.
Yeah, it was super smooth. Yeah, I kind of like went back to this group page a lot through this process, just to see what was to be expected. So I know that this was not necessarily under your treatment, but just people who have been through the treatment. Some people had said that the angiogram was the most uncomfortable part. So for me, I couldn't have had a better experience. It was a very good experience, and no discomfort on my end at all.
Good.
Yeah.
And then moving towards the angiogram was done, and I was back at the hotel, and I received a call from Dr. P. He explained that the angiogram revealed exactly what he expected, and he was going to move forward with the procedure. Once again, not to make it about me at all, but be back at the hotel and having to wait around for her to get out of procedure. That call was nice. And then we knew from there how long it was going to be. So patiently waiting around and And Jen wasn't awake for this part of it, obviously, but I got a call right afterwards again from the OR room explaining that everything went smooth. He was able to successfully implant the 2 stents, and it was time for me to, come to the hospital. So that part was, once again, a really nice confidence boost from the partner side of thing, to be able to be relieved that everything was going smooth, stay up to date. And the fact that it happened from the OR room, I think, is pretty awesome.
And I think it's very important for the family member who's there to know what's going on, because it's agonizing. My father had open heart surgery like, a year and a half ago, and was back home. It was during COVID. I couldn't go. I was waiting on the phone for like, 10 hours for a phone call. So I understand very well what it means for the partner or the family member to get a phone call and know that, things are smoothly, everything is going well. That's all you need to say. I mean, you don't need to have like an hour dialogue. It's just, that's what you want to know. Everything is as planned, we're done, or we're moving to the next step, or whatever it is.
Yeah. That was a big thing for you. We had talked about it after, and, I said, oh my God, how nervous were you? And he was like, I wasn't, because I got calls constantly. I was constantly being updated on my end. I just thought that was really cool, because like I said, I had a lot of procedures done in the past, and that had never been the case.
Yeah.
For you. So
then waking up out of procedure for you.
Yeah. So when I woke up, I did experience, which is super common, to have a headache. This was talked about before we even had the procedure, that I was most likely going to have a decent headache. And I did. It was like all localized behind my left eye. And I had a couple visual migraines in post-op, but again, I was still comfortable. I was there for about 4 hours, and I think it's pretty amazing that you can get this procedure done and go back to the hotel room and relax. It's like, it blows my mind that you're not in an ICU for a week and you're able to.
I think it's important, 2 things, because I think it's also important to answer a couple of questions, is how you felt that day, how you felt the next 2-3 days, how you felt when you got home, how you felt, meaning medically in terms of the headache, how you felt emotionally, what could be done better, what could be done differently. These things are important, and so and then we can go to the questions after that. But
Okay.
So go ahead. Yeah.
Well, you skipped over the big part of waking up.
What was the big part?
Not hearing it anymore.
Yeah. Oh, how did I forget that? Yeah, well, first of all, you're kind of like in a cushion to keep your head still. So I normally heard it all the time, but I was still in a little bit of a daze. So I didn't actually, when I could get up about 4 hours later, I didn't hear it. And I didn't want to psych myself out, but I remember telling the nurse, oh my God, I can't believe I don't hear it. This is like insane. Now the headache was decent. So when I went back to the hotel, I did, we were provided, you picked up some pain medication. And other than the headache, I was comfortable. I mean, we went back to the hotel. I had about 2 days of recovery. I think I had the headache for about a week, but every day it was significantly improved. Other than that, I'm trying to think of the symptoms that I had post-op. It really was just
any pain at the incisions, any pain at the bruising?
No.
Bruising. Yeah, you had a lot of bruising.
Well, I had bruising, but you're also on 2 blood thinners, so that's expected. I did not have any pain on my wrist or my groin, both insertion sites. No pain there. I was actually
mentally, you couldn't get over the fact that you didn't want to jinx yourself, like that it was gone. I remember keep asking her like about it. Do you hear it? Or can you believe it? And she almost didn't even want to talk about it. She's like, I don't want it to go away.
Yeah, it was like too good to be true. I even like now, sometimes I still find myself like sleeping with the fan on or sleeping with noise, because it's just automatic for me. But yeah, physically, I feel some 4 months post-op, I don't get headaches frequently. It's actually weird when I do get a headache. I don't have the localized headache or the visual migraines anymore. I don't get the the tunnel vision, if I'm changing positions, I don't experience that anymore. I don't hear the whooshing. Hopefully I never have to experience that again. I don't think I will.
The headache you had after the procedure was obviously different from, from your
Oh yeah.
chronic headaches. And
Yeah.
I think you started describing, I interrupted you, was like more like behind your eye towards like the ear.
Yes.
I think, yeah, just describe it a little more, like how you, and what kind, it was like a constant pain, was like worse when you cough, maybe when you sneeze, I don't know, when you move.
Yeah, so I like refrained from coughing and sneezing for about a week if I could. I remember like, because it did kind of scare me a little bit. The pain was pretty constant, but it did, like Tylenol helped. I actually never ended up taking any of the prescribed medication. I was able to just take Tylenol. So that was a big thing too.
And every day was better than the day before.
Oh yeah, like every day my headache would improve. And I think by the end of the first week, I no longer was experiencing it. And I really didn't even have the pain when I would cough. Like I said, I try to refrain from like big sneezes because I was just nervous. But yeah, I really never had any like significant pain back there. It was mostly just behind my left eye. But again, that was expected and we had talked about that.
And you wanted to express that you would never, you would trade that for dealing with PT.
Yeah, anybody who deals with the pulsatile tinnitus knows that, like for me at least, I would do that recovery over and over and over again if it means I didn't have to deal with like one day of whooshing. It was nothing comparable to what I've been through for 2.5 years. So, but physically, I'm actually able, we've been back in the gym, we've been a lot more active, which was something I was never able to do before. And mentally, I feel great. I don't know, I feel like friends and family notice a difference, but I just feel like myself again. I told Dr. P, like, I don't want to blow your ego up too much, but I truly feel like he gave me my life back. So I was more than happy to like give my testimony, to do this, because I am not a public speaker, like I said, but if it just helps one person receive the treatment and that I had, then I would do it all the time. So.
No, and I think it's important, and the experience from a patient is much more important than me describing to a patient what what the procedure is like and what to expect. So thanks for doing this. And I think if you can tolerate like 5-10 more minutes of talking, maybe we get some questions from the participants, and go ahead, Gabrielle. Yeah.
Yes. Thank you, Jenna. We have a lot of questions. I apologize to everyone. I will not give Jenna every question because I know there are a lot. And for the individuals, the panelists, please save your other questions that you have specifically for Dr. P. You can always email it to us at our email, and then we'll save it for future webinars. We're going to focus on Jenna's story right now, which we really appreciate, and it's been incredible. Everyone has this question, and perhaps you'll know what it stands for. Do you have a CTD? A lot of panelists are asking.
A CTD?
A CTD. So I don't know what it stands for. I personally don't know what that. Athos?
Connective tissue disease. Okay,
I don't know. I mentioned everyone's saying CTD.
Okay, I noticed someone said like Ehlers.
That too.
Okay.
A lot of people are saying that autoimmune disorders. If you have, again, it's whatever you're comfortable with sharing. It is.
Oh yeah.
Personal. Yeah,
I do think that the autoimmune disorders play a role in this. I'm not exactly sure how, but I don't have any of those. I have hypothyroidism, and I do have SVT, which is with my heart. But I did have I was allergic to the flu shot, and I had a bout of it's called chronic inflammatory demyelinating polyneuropathy, which is an autoimmune disorder too. So I have dealt with a lot of random autoimmune issues, and
whether they're related or not.
Yeah, whether they're related or not, but I seem to think that somehow I've noticed on the group too, a lot of people also deal with like multiple inflammation or autoimmune issues. So I do think that somehow it probably it all like plays a role with one another.
I will briefly add that probably inflammatory conditions play a role, and it's not clear what that role is exactly. But yes, there is a general association.
Question, Jenna, did the procedure resolve all of your symptoms? Example, visual tunneling, headaches, symptoms provoked by head position?
Yep, so I no longer get the tunneling of my vision. I no longer get the pressure headaches that I was experiencing before, or the issues, the positional issues from like bending over to standing up. I don't experience any of those. I do, the only thing that I still have after my procedure, and I have followed up with my ophthalmologist, is just like a small spot in my left peripheral vision. That's like a little wave in my vision, but that could just be from long-term papilledema or inflammation of my nerve. So, but I'll deal with that all day. It doesn't bug me.
And 2 more questions.
Yeah.
Is that okay with you? Okay. One question was, Jenna, why weren't you able to exercise? What stopped you? And this individual said, I have that too, and wondering if there are any similarities.
So for the exercising, it just made me feel worse. It just made me feel like I had a ton of head pressure. I also didn't have a diagnosis, so I felt like if I exercised and exerted myself and raised my blood pressure and my heart rate, that I was going to do something, or something was going to happen to me.
And you heard it more because of the blood flow.
And yeah, because of the elevated heart rate, it was more intense. I would hear it, and it was very uncomfortable. So I just strayed away from it. And also my mental health. I was really depressed and down, and I didn't feel like doing anything. So that played a role too.
It's also common with severe venous stenosis that when you exert yourself, it's not just the sound goes up, but the sensation of pressure in around the ear or in the head in general. It can also get worse. Like many patients describe that. So, I think you had some element of that too.
Mm-hmm.
Someone asked, how long did you take blood thinners after your surgery, if you remember?
Yep. So I was on Plavix and aspirin, I believe, you can correct me if I'm wrong, Dr. P, a month prior to surgery. And then I was on both blood thinners for a month after, and then you drop the Plavix, and based off Dr. P's recommendation, of course, but you drop the Plavix after 1 month, and I'm still on aspirin. I'll be on aspirin for a year post-op.
Correct. We start 5 to 7 days before, both aspirin and Plavix. And then continue for a month after, both. And then, as you said, aspirin for a year, and correct. And then that's that.
Yep.
And I think to wrap it up, one thing I just want to state that a lot of individuals are saying, thank you so much. They're really appreciative of you being so open regarding, your diagnosis and your experience. It's really helpful. And just for those who came on late, they're just asking, what was the end diagnosis again? And also, what was the procedure and treatment called? So just to kind of from the beginning, some people missed it.
Yep, so my diagnosis was left venous sinus stenosis with a post-stenotic aneurysm. So after the narrowing portion of my vein, I had a bulge in the vein. And we actually weren't sure whether or not I would need to treat the aneurysm until I was in surgery. So I ended up just needing 2 stents. They kind of overlap one another. Yeah.
I think for timing purposes, we won't give you too many more questions. Anything else you want to share with the group?
No, I'm always available. I'm in the Wooshers group. I can't tell you how crazy it is since I've gone through this experience, how many people deal with this issue. And there's times where I'm like sitting on my couch at night and I'm like crying because the messages that I get. I just wish I could help more people. It just helps to talk about it, because nobody in my immediate life knew what the heck I was talking about.
And they would say regular tinnitus.
Oh my God. If you've ever had someone be like, oh yeah, I have tinnitus. I'm like, you don't even know how much that hurts my heart. So yeah, just
especially if a physician tells you that, that's even.
oh my, I've heard it a million times. And it's like the worst thing to hear. I'm like, you just don't understand. So I was really grateful that I was able to do this. I was nervous. I still am nervous, but just be able to tell my story, and just in the hopes that it helps a couple people is all I can hope for. So I really appreciate it.
I will say, thank you again, because it's important. The story is important. The emotions that patients go through before the diagnosis, after the diagnosis, after treatment are very important. And I see the similarities. It's most patients that I see are, young women, they have, things to do, like professionally, socially, family, and the concerns are always the same, or almost always the same. So the story is very important coming from a patient, and I thank you for, sharing and being open. And one thing and I'll let you say the last thing, but one of the things that you mentioned is the importance of support, and the support can come from family, can come from professionals, can come from obviously friends and your partners and husband and wives, but this is something we recognized also, and Gabrielle, that is, just was asking the question, has support groups, online support groups for patients, specifically because we recognize these needs, right? There are patients who don't have enough support,
Absolutely.
who don't have, and even their immediate families don't understand, what they're going through and what this means. And so, we are trying to help with that also. And we're going to talk about that in on the future webinars.
Absolutely. If you need anything, I will leave my email regarding support groups. I know the Worcester's group is a large one. We have our own. And then also for anyone, just for you all to know, I know that Jenna shared being out of state. We do have psychotherapeutic support on our end. So if that's something that you're worried about prior to coming in, if you are utilizing Dr. Patsalides as a patient, as a provider, we do have the support on our end as well. So
I put the email in the chat as well, as Gabby will put hers, but I put notjustinyourhead@gmail.com, where you can submit any questions that you have. And I know we didn't get to all of the general questions that some people submitted before, but we're going to be doing these, every other week, or however many that you all want to see, we will make happen. So we'll make sure to answer all those questions.
So last comment goes to Jenna and her husband.
Yeah, I just think it's very important for the people that are struggling to be your own advocate. Don't let anyone stop you from wanting to you have to want to fight for yourself. That's one thing I learned, is that you have to want better for yourself. And if you're not getting an answer, don't feel discouraged, just keep looking, because you matter. So if anyone needs anything, my messages are always open. You can ask me anything you want. I'm an open book, and I really appreciate listening to me and hearing my story. Thank you, Dr. P.
Yeah,
and
thank
Kelly
you.
And everybody. Yeah.
Thank you for everything, because I can be the biggest one to attest that I have to deal with it every day.
Yeah.
This has been a big change in everything about Jenna when it comes to wanting to do more things and be happier, and it all because of the surgery. So thank you once again.
The pleasure is mine, and I'm obviously, humbled, and I'm happy to take care of you, as you know, and thank you for sharing the story. And to end this with on a kind of a light tone, I remember, Cody, the first time I met you, we were wearing a Spartans t-shirt, right?
Yeah.
This is the Spartan in my
Oh, there you go.
Very good. I like it. Go green.
Yeah, Michigan representation. Oh, last thing I wanted to note too, that I wanted to mention is I've been to New York. My family's from the East Coast, so it wasn't like super exciting to go to New York. Cody's never been to New York. So on the day 3 of my recovery, we went to Manhattan. So that's letting you know how I felt. I felt good enough to go to the observatory. I was like, was that a good idea afterwards? Because I could kind of shoot up there and bring it out. But Cody tried every pizza in New York.
Yeah, once I figured out she was okay, I was off to the races.
I was able to enjoy my final post-op day, enjoying New York. So
Very good.
if you're able to go,
It just goes to show how quick it is, the turnaround, and you can make a positive out of it. So.
Yeah.
Good. Have a good night.
Thank you, guys.
Everyone, this will be
Have a good
recorded,
night.
everyone. Just because there were
And,
questions, it will be recorded.
We will be
Yes.
recorded and posted, I think, on a YouTube. Okay, very good.
Everyone, have a great night.
Have a good
and
night.
see you
Good
soon.
night.
Bye.
Thanks again.